Thousands of doctors, nurses and other health workers have been infected with the highly contagious coronavirus globally. In some countries such as Italy, the data has sent shockwaves through the country's already strained healthcare system. With Kenya having 7 confirmed cases of the zoonotic virus, Kenyatta National Hospital has put in efforts to ensure its workers are not infected even as they attend to patients. But as Enock Sikolia reports, experts are warning that medical and protective gear available to health workers is insufficient in the event infections escalate.
They are waging a battle against the coronavirus since the first case was confirmed in Kenya. But being on the front line is risky. Exposure to patients who test positive increases their risk of getting infected with the virus. Kenya's biggest health facility is not leaving anything to chance. On Friday, it trained its staffers handling the coronavirus on how best to remain safe.
Donning is wearing the protective gear. You're wearing it in such a way that nothing comes into contact with your clothing or your body. And that's important because, as we've been told, this virus is spread by droplets. Okay? In doffing, you assume that this protective gear that you wore may be contaminated. So you have to remove it carefully so that you do not come into contact with the very things you are preventing in the first place. So those are very crucial steps for someone who's taking close care of a patient.
While some transmission is being stemmed by social distancing and shelter-in-place orders, exceptions are generally made for doctors and other essential workers. Yet many of these critical frontline providers are themselves unable to get tested, leaving their vulnerable patients at risk and the healthcare workers themselves in a seemingly impossible bind.
Because they're taking care of many people, you don't want them to be a portal of spreading infection to other patients.
In Liberia, during the Ebola outbreak, most diseases were infected in hospital. According to reports, a sizable number of healthcare workers got infected and transmitted the Ebola virus. Dr. Samuel Njenga of the Infectious Diseases Unit at the Kenyatta National Hospital says they have put in measures to ensure that does not happen at the KNH and Bagathi facilities.
In an isolation, it's not only the patients that are isolated, but you also have a dedicated team of health workers. So in an outbreak situation like this, we don't encourage that a health worker works in a general ward and then goes to an isolation.
World over, the virus is picking off doctors, nurses, and others needed in the rapidly expanding crisis. According to Dr. Njenga, the risk to Kenyan healthcare workers is one of the great vulnerabilities of the country's healthcare system in an epidemic like this.
You have also lost someone who would have taken care of those who are infected. So it even reduces our capacity to respond to an outbreak.
With the coronavirus infections on the rise across the globe, figures show enormous level of contagion among healthcare givers. For example, in Italy, over 2,600 healthcare workers have been infected with the highly contagious viral disease. Now, that represents 8.3% of the total cases in the European nation. Indeed, risks of caring for infectious, seriously ill people under the pressure of a pandemic are almost impossible to avoid. In China, 3,387 healthcare workers were infected by February 24th, almost all in Hubei province, the center of the outbreak, according to Chinese health authorities.
Of course, we have challenges in that area. Protective equipment, the things you had them talking about, masks and gowns and goggles, are very expensive and are not available. And I think we appeal to all well-wishers who would wish to support health facility. Adopt some health facility near you, support.
Experts say the danger of having healthcare workers sidelined and unable to care for patients can present a conundrum for which there is no plan B at this point. Enock Sikolia, Citizen TV.